How often do we see the return of a pulse to a patient who is in cardiac arrest from CPR only? The best data that we have comes from this Canadian study that was published in 2001. This was an observational cohort study that involved 9,667 patients, and they set up a 7-member expert review panel to evaluate the cases where it was reported that a pulse returned from CPR only, and they identified 97 cases. That is 1% of those cases. Of those 97 cases, 24 of them were determined by that committee to have actually been pulseless. That is 0.25%. And of those 24 cases, 15 were discharged from the hospital alive. That is 0.16%. What's interesting about this is how many of these patients actually presented in asystole. There were 9 patients who presented in PEA, 12 patients who presented in asystole, and 3 patients who presented in ventricular tachycardia. And what's cool is that one of those patients converted from VTAC to a sinus rhythm with a precordial thump. So someone having a pulse restored from CPR alone who is in true cardiac arrest is exceptionally rare, and there should be no expectation of this happening when performing compressions. It is a bridge therapy until help arrives, and I will post a link to this paper in my bio.